How's everyone doing? All right, thank you for attending our first Back to School with Celiac Disease program. I'm Dr. Ashwin Agrawal. I'm the medical director of the Pediatric Celiac Disease Center at RWJBarnabas Health. And first off, I want to thank everyone who's here today, and then also our excellent team who's taking time off after work to come here to present some information to you guys. And this beautiful space we have here at the LiveWell Center, and Jen and Abby and her team who makes everything possible over here. And then as well as Dr. Teitelbaum, who's our chair of pediatrics, who's sitting back in the corner over here, who's made the celiac disease possible as well. So first, I just want to introduce our center. So we are currently the only multidisciplinary pediatric celiac disease center in New Jersey. And we are the only pediatric celiac disease center in New Jersey that has a designation from the Society for the Study of Celiac Disease. So our goal is to bring every child and family with celiac disease cutting-edge diagnosis, comprehensive care with their dietitian, psychology care, mental health care, and compassionate care for celiac disease. So, as I said, we have a team approach here. So we have expert gastroenterologists like myself, we have expert dietitians, social workers, and psychologists who all help manage our child and family with celiac disease. Because as you guys know who have celiac disease, it's not just a one-person disease. It affects everyone in the family. So getting to tonight, so we're going to be talking about going back to school, right? You guys are going back to school? Yeah? What grades are you guys going into? First grade? Okay, sounds good. Preschool, okay, great. So we all get little, butterflies in our tummy when we go back to school, right? And that's all normal. And people with celiac disease can have more butterflies for different reasons. And hopefully today we're going to give you some tips to manage some of those butterflies in different ways, okay? So first up, we're going to have our dietitian. She's our GI dietitian, Katelyn, talk about, back to school with our meals. Then we're going to have our excellent social worker, who's also one of our diabetes educators, talk about 504 plans. And then Dr. Quezada, who's our newest addition to the GI family. She is a GI psychologist, and we think probably the only GI psychologist in the state currently who will provide some stress management techniques. And then I'll come back, and then Jen will talk about how to pack some gluten-free bento boxes. And then I'll come back and we'll have a little Q&A and talk about the future of celiac disease. So we'll get started with Katelyn.
Hi, everyone. My name is Katelyn Guli. I'm the dietitian for pediatric gastroenterology. I see some faces I recognize here. Thanks for coming today. So today is just to talk about, I know as parents and children, we have a lot of preparation to do going back to school. And for all of our families, it's stressful trying to figure out, well, what am I going to pack for lunches, or is my child going to get the school lunch? Whether your child has celiac disease or not, it can be a stressful time trying to plan, okay, what is the year ahead going to look like? There's a lot of, common complaints from families. Maybe I send lunch for my child and they come home and they haven't eaten it, or my child just wants this one specific sandwich, so I make the same thing every single day and the child's eating it and then eventually decides they're not eating it anymore. So a lot of parents come to me just asking, like, I don't even know what to pack for lunch. So in sessions, we work a lot on meal planning, finding out, well, what does your kid like to eat overall and how can we make a meal out of this? Some of the concerns that families might have is, how does my child stay safe in the cafeteria setting? How do I help prevent their, cross-contamination? And so we like to, reinforce that if your child has celiac disease, they don't need to sit at an allergy table. They don't need to be, set away from the rest of their peers. And so we like to, let families know we're not worried about all of that, as long as your child knows, not to eat other people's food, right? And if you have some families are curious, well, can I get the school lunch? Are they able to accommodate me? I always recommend reaching out to the principal of your school and trying to get in touch with the food service director. Often there's a food service director that's overseeing your district so they may be overseeing a bunch of schools, but that's the person who's really going to know if they can accommodate a food allergy. And I hear a lot of feedback of all different ways that it's managed. So some families will say, yeah, there's a food service director in our district who provides a cycle menu, and I can order ahead of time, and every single day I have a different option of what my child can eat, and we see the menu ahead of time, we pick what we want. So that in an ideal world, that would be the accommodation. But in other districts, it may be there's a gluten-free meal available, but it's just the gluten-free chicken fingers, and you'd have to get the same thing every single day. So there just aren't a lot of options. I'd say realistically, I'd say most of our families do bring food from home. Just gives you a lot more control. And some common concerns I hear is maybe your child is not a big bread eater. Maybe they haven't found a gluten-free bread that they like. And then when we realize if my child doesn't like to eat sandwiches, well, what am I supposed to send for lunch? And so a lot of parents kind of get stuck. Like if I can't send a sandwich, then I can't think of anything else to send. Because obviously in the school setting we have the limitation where we don't have access to a microwave. So we're having to do foods that are cold, and then you're worried, well, how do I keep the food safe? Or what if a lot of our families, children may be really used to like home cooked foods. They love a hot meal, and so going to school is difficult because they may not like a cold meal. And so trying to figure out what we can pack and how we can accommodate, for each kid. And I always recommend, sitting down with your child, and this is kind of the process I go through, but kind of making a list. Okay, what are the foods that my child eats? I like to break it up into food group. Like, what are the fruits my child likes to eat? What are all the vegetables they like to eat? What are all the different types of meats or proteins? What are the dairy foods they like? And then what are the gluten-free grains that they like? And I always recommend like going through that process and then looking, okay, which of these items are foods that could travel to school? Which of these would stay good in a lunch bag at school? And now that it's the end of the summer, it's a good idea to kind of brainstorm what you could send for lunch and then kind of practice now. So for example, some of our families who children really prefer a home cooked meal or prefer hot food, some of the families have good success with using a thermos container and preheating the food, putting it in the thermos container. You can preheat the thermos by adding hot water to it to make the thermos hot before you even put the food in it. And then some kids open up that hot meal a couple hours later and it's just the thing they wanted and they're very happy. Some kids, if the temperature is still not quite right, like it didn't quite make it or it got a little soggy, that's might not work for them. So I love using summer as an opportunity to say, okay, we're gonna reheat something in the morning, and then we're gonna at 12 o'clock today, let's open it up and see how the texture is, and if my child's still open to eating it. Dinner leftovers, if your child does like a hot food for lunch, dinner leftovers are always the easiest because we have to be realistic too. We go as moms, we go on Instagram and we see these moms making like sushi style, like swans in their bento boxes. It's not realistic. We have to think about a routine that we can sustain throughout the whole school year. So you might be making lunch for multiple children. You might be also making lunch for yourself, for your work or for your spouse to go to work. And so I don't think people realize how much thought actually has to go into preparing a school lunch for your child, because if you have multiple children, if they're like my kids, they eat totally different things. So you're like putting all these things together, you're putting all these things together, making sure you don't switch them. And it actually takes a lot of time. So I like to recommend trying to, if your child likes dinner leftovers, I like to say, when you make dinner that night, put aside the portion that your child may eat for lunch tomorrow, put that aside first, and then serve the family dinner, because otherwise all of it will be eaten and you won't have anything left for lunch the next day. So I always love dinner leftovers as the kind of the most convenient option if your child will accept hot food, by lunchtime the next day. And then I came up with a list. Another thing I like to do is, if we're going with the cold lunch option, I made a handout here, but basically I made a list of each food group and then foods that travel well cold for lunches. And we don't always have to think about lunch as a meal that's cohesive, like a lasagna with a roll and something like that. Meals can really be, okay, I took a food from each food group, put it in a bag or a box, and then my child ate that. And it helps for variety too. I always recommend that if there's something your child is really eating a lot right now, like they love, I don't know, peanut butter on rice cakes, for example, I caution against sending the same thing every single day, because they will reach a point where suddenly they don't want it anymore. So I like to think of, okay, what are 2 or 3 things that my child agrees to that they'll eat, but let's rotate it throughout the week so that they don't hit that point of burnout. And then, so some things I like to recommend. So out of the 5 food groups, I always say, try to hit at least 4 of those food groups with the foods that you're packing. And so, way I like to look at it is we want to include a dairy food. So that could be a yogurt, or they sell like the ultra high pasteurized milk cartons that are sealed, or you can do cheese stick or cheese cubes. Those are all good dairy options. And then we want to add some kind of fruit. Fruit is kind of the easiest group because a lot of those fruits travel really easily. I just put some examples like strawberries, apples, grapes, even fruit cups. mandarin oranges, but I would do 2 because they're very tiny, a bag of blueberries, a pear, some cut up mango or a banana. Those all travel really well. Vegetables, people have a hard time trying to think of, but I always think of, okay, what are the cold vegetables that travel the easiest? So carrots are a great option. Sliced bell peppers or the mini sweet peppers, sliced cucumbers, carrots, and sugar snap peas are some examples of some vegetables that kind of travel well to school, obviously within whatever your child's preferences are. And then for the protein, you could do something like a hard-boiled egg. If your child likes deli meat, you could do turkey just rolled up by itself or with cheese rolled up. I like to do hummus, the individual hummus cups that you could dip your vegetables in. If your school allows peanut butter, you can do those individual peanut butter cups. And then even protein, something like beef sticks. They sell like the gluten-free beef sticks that a lot of the kids like, and that's something you could kind of throw in there for your protein option. If your child's a fan of gluten-free, say chicken nuggets, that could be something set in a thermos that keeps nice and hot. And then anything with tuna fish is another like nice cold protein that we can send along, or nuts or seeds or like trail mix. And then for our grains, we have, sending something on the side. It doesn't have to always be, parents always want to send like a crunchy, salty snack, but we almost always just think of potato chips. But we have a lot of other options like rice cakes. I like doing individual bags of popcorn, some gluten-free crackers, a gluten-free roll, or like a baked chip, something like that. So we do get still that crunchy, salty snack, but something on the healthier side. And I always recommend trying to choose at least 4 fruit foods from each of the 5 food groups. And when we work in this framework, it helps it so it's not so repetitive. So maybe we're rotating what the fruit option is, or we're rotating what the dairy option is. So that way it's not the same meal every single day, which increases the likelihood that your child will eat it. And if you find that your child's coming home, they're really regularly not eating lunch, just looking into, well, what's going on at lunch? How long do they have to eat? Is my child a slow eater? Am I making it too complicated where they're having to like stack up cheese and crackers and it's just taking them too long? Do I need to send a simpler meal? Asking the teacher or the aides, well, what are they doing? Are they talking the whole time at lunch? And that's why they're not eating. Things like that, trying to figure out, getting to the bottom of, okay, what's going on? And if your child doesn't eat great at lunch, I always love to tell parents, like, if possible, when they get home from school, open that lunchbox back up. You already worked so hard to make that well-rounded meal. That can be your after-school snack. And definitely using an ice pack to keep cold foods cold so they're food safe throughout the day, or an insulated up thermos container to keep hot foods hot to make sure it's safe. So those are kind of the brainstorming ideas I like to come up with to help families decide how to get through the school year. Let me see if I had any other topics. Do you guys have any questions about anything about packing up lunches? Oh, another thing I like to mention is I love to involve children in the food preparation, because we're always working towards those self-care skills, that independence. And as young, it doesn't matter how young they are, you could say, okay, I lined up all the baggies, you put them in the lunch bag now. Involving them in age appropriate ways to do it, because one day that kind of gives them the confidence and autonomy that they're involved in their own food preparation, but also one day that's a chore that will be lifted off of your table when they can actually pack their lunch on their own. And then I do have a handout on label reading, because of course with needing to do a gluten-free diet, we're looking at any packaged snacks we're throwing in there, making sure they're gluten-free. And so I do have a handout on label reading, which I know I always go individually over sessions. And so that's all I have for our lunch preparation. So we are going to hand it over to Lisa.
Yeah, that was great. I mean, one thing, obviously, with a young audience here.
Yeah.
I mean, maybe at another time, to talk about going off to college.
Mm.
Yeah.
Yeah.
The major theme, like, how do I manage
Mm-hmm.
cooking in college?
Mm-hmm.
As far as what college, because they can accommodate
Mm-hmm.
things like that. So maybe not today.
Yeah.
But maybe that'd be a great thing, for us.
Yeah, it's like those big life transitions and looking at, well, what cooking skills does my child have at this point, and what access do they have to a common area or a kitchen or the cafeteria, things like that are all good things to consider in that big transition.
Well, guidelines going to be published soon.
How do I?
Are schools required to offer at least?
So my name's Lisa Ball O'Brien. I'm a social worker, and we're here to talk about 504 plans. So a 504 plan is the plan that you come up with when you're speaking to the school about accommodations for your child at school. It's a written agreement, and it's legally binding, so it's important. The recommendation is that you do the 504 plan, as opposed to there's a step lower than that called an individualized health plan. And that's kind of essentially your nurse agrees to do something. We recommend at least a 504 plan. There's also an IEP. So if your child already has an IEP, you can incorporate your 504 plan, your celiac accommodations into your IEP. But you don't need an IEP. That's complicated. We would recommend a 504 plan. Next slide. And how you get a 504 plan, you request a meeting with school. I always recommend you do it via email because there's a time and date stamp to it. The timer starts then, and because they're legally it's important that they respond to you in a timely fashion. Each school looks a little different. So some school districts, it's the principal is the 504 plan coordinator. Sometimes it's the nurse. So you would just need to figure out at that school who you would contact and request that letter of. To get a 504 plan, you need a diagnosis or a disability. Don't like that word, but to qualify to get those accommodations, that letter comes from your physician. I have here for you guys to pick up on your way out is both a copy of what the physician might write for you and a copy of a sample 504 plan. They're both provided by celiac.org, which is an organization, tons of resources. And they actually are also running a series of webinars once a month on 504 plans for the foreseeable future, like the next 4 are already planned. To go to that meeting, we want you to be prepared. We want you to know what to ask for. That is something you should probably talk about with your doctor if there's any particular concerns. And then it's renewable. So once a year, you should probably revisit. Someone who is in first grade kind of maybe needs different accommodations than someone who's in high school. As one gets older, we're talking about independence and going on to college. We are probably way more concerned about the kindergartner or first grader, making sure that their environment is protected than the 15-year-old who should know better or the 18-year-old who should know better. Each year that needs to be adjusted and changed. The Celiac Disease Foundation, this is examples of things that they recommend you ask for. Unrestricted access to the bathroom, gluten-free materials for learning activities, gluten-free foods in the cafeteria. We know how complicated it is. I'm a diabetes educator by training, so my focus is more on diabetes. But when we talk about this, it is certainly a challenge, and it's hard to believe that what the school says that they will provide, will they actually provide it? So it's a challenge, but there's certainly opportunities for you to ask for gluten-free foods from the cafeteria. And working collaboratively with the parents and the school. So it has to do with communication. How do you, there's a party coming up. The parents need to know that. being able to provide an alternative. So if there is a special treat in a classroom, being able to always have something on offer that is acceptable for that student. And then there's some other things. You can ask for some exam accommodations or absences, but for the most part, if your celiac is under control, you wouldn't need any sort of those accommodations. But so those you would definitely want to be talking about with your physician about, is it appropriate for you to even ask for those things? This is a list of what the Celiac Disease Foundation has on offer. There's the list of the webinars, and then here is where that 504 plan template and the physician letter there's links to it. So if you wanted to give me your email address, I could send you these slides and include all those links with the hyperlinks. So one of the things that I really recommend when you're with your student, your child, is creating just a very simple document that all the teachers that your child has gets a simple document, picture of your kid, what the concern is, the gluten allergy, and ways that the teacher needs to be helping you protect them. It can be very simple, things to avoid, things to look out for, but it is helpful that each one of the teachers have it, because then it can be part of the teacher's like substitute teacher pamphlet or folder or whatever, so that even when there is someone coming in, that everyone knows what the situation is. Because a music teacher might give out a treat, you know what I mean, and that you wouldn't necessarily think that way, but it's a special day, it's sunny outside, whatever. So it's important that all the teachers know what the limitations are. And I like that because I like the picture. They can see the kid. It's easy to identify. And then the last thing is what happens if the school says no? Well, you can push it. You're legally, if it's a school that gets federal funding, they are legally obligated to do a 504 plan. I have a patient I'm working with that recently their school said no. And I'm like, you can't say no. So the issue then comes up is, what do you want to do with that? You go up, my recommendation is go up the chain of command at the school. If the 504 plan coordinator says no, you go to the person above them. If it's the principal of the school, then you go to the superintendent of the school. You explain why this 504 plan is necessary. And then you can actually file a complaint. And there's a link to where through the ADA, at the federal government, you can file a complaint about if it's not, if the schools continues to refuse. But I think if you push back, they'll relent, because you're just simply trying to protect your kid. And it's important for the school to appreciate why that's important. So that is what I recommend. And the 504 plan should be what you want. You will see in the sample, as there are samples of all sorts of 504 plans, things you can possibly ask for. But my recommendation always is to ask for what you need and not more than what you need. I think it's helpful and in terms of building a relationship, because you want this relationship with the school to protect your child and to, from any sort of exposure to the gluten. We're going to do questions at the end, but I would be happy to answer anything at that time.
Okay, so I'm Dr. Quezada. I will be talking about anxiety and coping skills that we can use to help manage anxiety. So before I start, I wanted to ask you guys of your understanding of anxiety. Any of the parents want to share what you think anxiety is? Or maybe you?
Like right now? Yeah.
Right. So that can be anxiety, right? Many times when we think about anxiety, we think about worry and fear, but in reality, those are normal feelings that we all have in different situations. When we are talking about anxiety, we are talking more about the overwhelming fear and worry that we can experience that then becomes difficult to manage. The good thing is that we can learn to identify anxiety in our body, and then we can learn skills on how to manage those feelings. So when you are feeling nervous, you can feel it in different parts of your body. Many kids feel it in their chest, like their heart goes super fast, or sometimes they feel it in their belly when they feel like butterflies inside or like cramping pain. Some kids or some people can feel like sweaty palms, or even just clenching of your fist because you have so much energy that you don't know what to do with it, right? So I'm sure we have all have felt that at one point or another, right? That can happen with presentations, or it can happen when we are making new friends and we just have racing thoughts that are kind of making us feel overwhelmed. So we can use coping skills to help manage those feelings. Okay. So the first one that I want to talk about is diaphragmatic breathing. Have you ever heard of that before? Great. So it's a fancy way of saying belly breathing, right? When we are feeling anxious, we want to breathe with our stomach, no, not our chest, because that will give more energy to our heart and that will make us feel more anxious and nervous. So just to practice, if I can ask the moms and you over there to practice with me, what's your name? May. Okay. So we're gonna practice ways to feel better when we're not feeling so great. Okay. We're gonna put our hand in our chest, hand in our belly. We're gonna breathe in with our nose, pretending that we have a balloon in our belly that we want to inflate. And then we're gonna breathe out and deflate the balloon. Okay. We're gonna breathe in with our nose and out with our mouth. And we'll try it one more time. In with our nose. Belly goes out with your mouth. Okay. So if you practice that a few times, it's going to help your heart feel more relaxed and your body is going to start feeling more relaxed as well. There are different skills as well. We can pretend we have a square in front of us, breathe in, counting to 4, breathe out, counting to 4, in 4, out 4. Okay. There is another skill that we can learn, and I really like, and I think that kids usually love it. It's the bear hug. So you kind of hug yourself and you breathe in, counting to 4, and out counting to 4. Okay. If you practice that a few times when you're feeling not so great, it can really help you. If, let's say, you are in a school, you're feeling super anxious, overwhelmed, and you are able to go to the bathroom, you can also wash your face with cold water, and that can help your brain understand that, okay, I'm good, right? Because we want to let our brain know that we are safe. Okay. And then there is another thing called progressive muscle relaxation. Have you ever heard of that? Yes, yes. That is exactly that. So I brought a little squishy here. Squishy toys. I'll give the kids. So I'll give you this so you can practice with me, okay? Sounds good? Okay, I'm gonna give you two. We're gonna pretend that these are lemons. Yeah, I have lemons. Okay, so I'll give you two. There you go. Okay. So we are going to help our hands and arms feel more relaxed. We're going to pretend we have a whole lemon in each hand. We're going to squeeze it really, really hard. Try to squeeze all the juice out. Feel the tightness in your hand and arms as you squeeze. Squeeze hard, hard, hard. Don't leave a single drop in the lemon. Hold there for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. You can now release and see how much better your hands and your arms feel. Just like that, you can do it with every part in your body. Let's say if you're feeling the stress and the nervousness in your shoulder, you can just squeeze up your shoulders as hard as you can, count to 10, and then release. Okay? So these are different skills that you can try out to feel better when you're feeling a little nervous or when you're feeling nervous about making new friends at school.
I actually really love. Besides gluten, no. Those are actually like allergy free.
Yeah. I love-
Yeah. We have those. We have pretzels. I can do little cups of pretzels too. And then I'll show you our little demo. And then after, once we're finished, the kids can come up and actually make a little bit if they want to too. You want some pretzels? Pretzels. Got it. Okay.
What do you think your sister wants? Pretzel.
Pretzels for everybody. Whoop. Making a mess already. Sister. There's some extras out there. Okay. All right. So let's get into just a quick little cooking demonstration. So my name's Jennifer Klein. I am another registered dietitian. I work here in our LiveWell Center as part of the community health team. So what we do for our nutrition programming is we help our community members put good nutrition into practice through cooking demonstrations and hands-on cooking classes. So what I'm going to do today is show you two very simple gluten-free meals that you can make as a family for your back to school. And so kind of going along the same lines as Katelyn recommended, we're going to be making little bento boxes today. So instead of, the traditional sandwich, we're going to be putting together a couple different snacks that are going to build our little lunch in our boxes here. So I have our little finished product here, but I'll show you those as we get through the whole demo. So I'm just going to grab my gloves really quickly. And somehow I lost track of my toothpicks. We're definitely here. Oh, thank you. Thanks so much. Okay. So the first thing that we're going to do is we're going to make little kebabs. So have you ever heard of a kebab before? You know what that is? That's food on a stick. I always find that our kiddos love food on a stick. Whether we put, sweets on a stick or sandwiches on a stick, it's always fun to eat something on a stick. So what I'm going to do today is show you a little chicken salad on a stick. So we have some chicken. So this is a prepared grilled chicken. This is a gluten-free one. So this is one of those Purdue shortcut chickens. Obviously, you can also just make your chicken at home. So as Katelyn mentioned, leftovers are really great. So if you're grilling up some chicken, baking some chicken, nice to dice that up to make this lunch, later on or throughout the week. I also have some lettuce here. So this is just some romaine lettuce that I cut into strips, so long strips like that. I have a little bit of cheese. So I like to do these little balls of fresh mozzarella. And then I have some veggies. So one thing that I like to do, again, as Katelyn was mentioning, trying to make our lives easier as parents as we are building our lunches and our meals throughout the week. We can set ourselves up for a little bit of stress-free, easy success if we kind of put a little bit of work up front. So I like to take some of the veggies that my kids like to eat, and then I'll cut them up ahead of time. And so this time I cut them up in the shapes that I want for my lunches. So I have some cucumbers, some tomatoes, and then some bell peppers. So for our little kebabs, I'm just going to start off with my lettuce. So I just take my lettuce and I just kind of fold it like a fan back and forth like that, and then pop it onto my little toothpick here. This is kind of like a long toothpick. I like this size rather than the really big ones. They're a little bit easier to manage. And then I have my cube of chicken. So I'll pop that right on. And then a little piece of tomato, a little piece of cucumber, centered. Grab another little piece of lettuce here, another piece of chicken, and then the cheese, which personally is my favorite part. I like the cheese. And then we have a nice little kebab here. And of course, you can put whatever types of flavors you like on here. So if one of these veggies isn't your favorite, you can swap that out for another. You can put, different types of meat on there as well, or you can keep it vegetarian and just do the veggies and the cheese. So then when I have them all together in a little box like this, these are literally the ones that I send to school with my kids. They're a pretty good size. I can fit usually like 4 or 5 of these little kebabs in one of these little containers here. This comes with a little ice pack that goes under here, so it keeps that chicken nice and cold. And then to balance that meal, so for our kebabs, we have some vegetables. We have a little bit of protein with our chicken, and then we have a little bit of dairy and some protein with our cheese. So we want to fill the rest of this meal up with a little bit of maybe a carbohydrate green and our fruit. So I have one of these Made Good granola bars. These give a little bit of green, little carbohydrate. They also have a little bit of like a chocolate flavor, so kind of nice to have a little sweet treat in your lunch as well. And then we have some blueberries and some of those thinly sliced red bell pepper. So we have a nice little complete meal here, and it's colorful and it's cute, and kids can help to put it together. So kebabs are really fun. You can kind of line up the ingredients and have kids build them on their own. And then if you want to pair a little dressing or something with it, you can. So you can get a little container, fill that up, and then they can dip their little pieces of their kebab in their dressing. So then our second little snack that we have here, I'm going to grab my other refrigerated items. We're going to do a little spin on a sandwich wrap for this one. So I have some turkey and some cheese. So these are just, found at any grocery store, really. I'm going to grab a nice piece of my turkey here. So we have, again, some of that protein. And then I'll do 2 of them at a time. And then we're going to grab some nice sliced cheese. Any flavor will do. I like the thinly sliced ones for this recipe. I think it just rolls up really nicely. All right. And then I like to add a little color to this meal. So I like to add a little bit of our veggies in here as well. So that's where I'm going to be using these thinly cut vegetables. So I have a couple pieces of this red bell pepper. Just put that right kind of towards the edge there. And then a couple pieces of our cucumber. And roll that up. And then we just roll it like a wrap. Nice and gently. If you'd like something like honey mustard or hummus, you can spread that on here too. Hummus helps it all kind of stay together nicely. But if you don't like that, that's okay too. It stays together pretty well once you slice it and put it in your lunchbox. So you can eat it just like this. So you can put it, in that lunchbox container like this. I like to cut it up and make it into almost like little sushi rolls. So you cut that, and then you can see that nice little spiral of color and all that yumminess in there. And then, again, you can pop that into a lunchbox like this, where we have a couple of our little turkey, cheese, and veggie roll-ups. For this one, I paired that with some pretzels, gluten-free pretzels, some tomato slices, and those blueberries. And of course, again, like Katelyn was saying, you can swap out all different types of fruits and veggies and do all different types of combinations. A couple other ideas, which I have recipes written here for, would be something like breakfast for lunch, which I know my kids love when they have French toast for lunch. It's so exciting. But you can get pretty good gluten-free waffles, those little mini waffles. Cook those up ahead of time. Pop them into the bento box with a little bit of syrup and some fresh fruit. I also like to do a little bit, sometimes instead of syrup, I'll do some Greek yogurt mixed with a little bit of cinnamon, and so like a vanilla Greek yogurt mixed with a little cinnamon. That's a nice little dipper for those waffles to add a little bit of protein, a little bit of calcium, and to just kind of make that meal a little bit more filling. You could also put in, a little bit of like a breakfast sausage or something like that to add some protein. Another one is taco bowls. So if you think about, kind of almost like a Lunchable, but with tacos. So you can take some leftover taco meat from your meal the night before, put that in your bento box with some shredded cheese, some salsa, and then most tortilla chips, like corn tortilla chips, are gluten-free as well. So you can add those together and they can build little nachos, for their lunchbox. And another one I thought of that wasn't on there that could be fun if your kids like sushi, you could do a little bit of leftover rice, making sure that it stays nice and cold with some edamame and then the little seaweed snacks, and you can kind of build a little sushi bite with that. So lots of different options. Just sometimes it takes a little bit of thinking ahead and getting yourself prepared to be able to make these lunches pretty quickly. Any questions on that? No? Okay, cool. So we do have some other snacks here too. I mean, there are a lot of naturally gluten-free things that we can put in our lunch boxes. But when kids are looking for those things that, typically do have gluten, most grocery stores, we do all of our shopping right at ShopRite, and they do have quite a few options. I will say some stores are really good at keeping all the gluten-free things in one spot. And some, it's just like, you really have to read the labels because there'll be like a whole bunch of things that are gluten-free. And then the next thing I'm like, oh, I didn't realize that was gluten-free. It's like, oh, because it's not, but it's just next to all that gluten-free stuff. So, just be careful when you're looking at those things. But there's lots of different options out there. And I think, through the years, they've really done a good job of expanding the options and making them pretty tasty. All right. So I'll turn it over to Dr. Agrawal, and then we'll have our kids come up if you want to try to make a little snack with me up here.
All right. So we've learned a lot about what's been going on. I'm just gonna hold it. We've learned a lot about what's been going on, about how to manage your diet, the school and all those things. And I want to talk about a little bit about what might be upcoming in the future about celiac disease. So, one of the things is, there's a lot of trials going on currently. A lot of phase 2 trials, a couple of phase 3 that might be coming up, and those are just the way the FDA kind of classifies trials. As we get to phase 3, if you pass phase 3, then you get a new medicine. So our hope is that hopefully in the next 10 years or so, there'll be more treatment options that are saying you need to be gluten-free. Okay, I think one of the probably ones I think might come in the future sooner than later is one of the things that causes parents a lot of anxiety is when I go out to eat, how do I make sure things are truly gluten-free, right? You can ask the restaurant, you can advocate, but at the end of the day, you don't know what the cross-contamination and those things are. So they have been really working on specific enzymes that you could eat when you go out, so that maybe any of this cross-contamination would get broken down, so you would have either no or less of a response. Now, that being said, these ones right now are not going to be that you can do with every meal and eat anything you want, but this is to really prevent the cross-contamination. I do want to caution people that right now you can go on outside and find things that are called gluten supplements, gluten enzymes. Those are not for people with celiac disease. So those are not going to break down the protein enough to not cause your body to react. Okay? So don't try those, but hopefully in the future we'll have other options. Now there's other therapies being trialed. So there are infusions being trialed in adults right now that could maybe, they're called immunomodulators. It could modulate your immune system so they can be tolerant to gluten. There's some infusions, some oral nanoparticles that they're trying. So the goal of these types of therapies is to try to get your body used to the protein of gluten so that you can eat it again. And then we have things called biologics. So these are things that block inflammation responses in our body. And the thing with celiac disease is that when we eat gluten and our body senses the protein, it attacks our intestine by causing an inflammatory cascade. So if we can block this cascade, we can block the reaction from occurring. These are the different types of studies that are going on right now for potentially the future of celiac. So hopefully, as she gets older, we'll have other options. There might be soon enough. And then, a couple of my top tips for going back to school with celiac disease is one, you definitely want to talk to your teacher and make sure they have some So give the school some non-perishable treats, granola bars, prepackaged cupcakes, something, because things come up, right? They have impromptu parties, another classmate brings cupcakes for school, the class. You want your child to be included and they can get their gluten-free treat, right? The thing with the 504 plans, my biggest thing with that is it's a negotiation with the school. You want to keep a good relationship. If they're really pushing that, get your gastroenterologist to get on the phone with the principal. I've called the principal, we have a discussion, and it usually does help. You have to be persistent about it sometimes. And sometimes they'll give you a plan that is like, this does not make sense. Definitely came from some other child. They didn't put effort into it. Yeah, so then you come back to the drawing board, sit down with them, and try to make things work better. When you guys go to the celiac.org 504 plan like demos, you will have hundreds of things you can ask for. If you ask for 100 things, you're gonna get 0. Pick your top like 10 that you really want. Because the principal, the superintendent, they're gonna get overwhelmed if you give them too much. Pick your top ones that you really need. And then, I think the anxiety management is super duper important. The progressive muscle relaxation, I still do that. All my board exams, all those things, I do those. I think it works. Something good to teach all the kids. And I think we'll open up for questions now. $100. Yeah, so a treatment plan, a IHP, they are not true happening. So, good. Yeah. So the question for the people online was that, if the school is offering a treatment plan or something else that's not a 504, should we really be pushing for a 504? I think absolutely. I think a 504 makes you sit down with the players involved, right? So at that meeting, for celiac disease, you really just don't want the principal or the superintendent. You want to make sure that whoever's in charge of the cafeteria, the charity services person, is there, because they actually might know more. The principal may not know that they already have gluten-free foods. Sure.
How about now? Sorry. So we'll repeat the whole thing. The question was, why for school? And there's it's not any sort of expense. There is some time involved, but it's legally binding. And so if they fail in some way, they run a risk. And so the greater their obligation, the greater the risk.
Any other questions? Any online questions? No? No online questions. All right. All right. Anything you guys want to add? Yep.
The referral does have to come to our GI providers. So just speak to your provider and they can refer.
All right. So, thank you for attending tonight. Hopefully this helped answer some of your questions about celiac disease and hopefully makes the transition back to school a little easier. And then we're here to help you, all of us. So if there's any issues, come join us in clinic and we'll help try to make things better. All right. Have a good night, everyone.